6:33. Call it to order. I know that unfortunately, our clerk, Cindy, has left. She moved away to start a whole new life, and I'm really excited. I've been with Cindy since she was started here. I miss her terribly already. I was all upset over the phone with her, but we wish her the best. But unfortunately, we don't have any minutes from last month's meeting. So we will apologize and we will get those together because it was a little bit quicker than we thought with Cindy, and she did what she could for us, thank God. And so next month we'll do over those. But we do have an agenda. And we can start, I'll start with that. Is there anything, first of all, is there anybody here to speak? Is there anybody online on the Zoom? Okay, so we'll open citizens' time and we'll close citizens' time. How's that? In less than 20 seconds. I got a reputation. Okay, so nothing, no public participation, no approval of the minutes. And we will start with you, Anthony, with the health director's report.
Okay, so thank you. I'm just going to dedicate the first little bit of it to talking about Cindy. Cindy had been with us for 11 years, preceded my time, but had been around for a lot of other folks here. She did a great job while she was here. This department has changed a lot in the last 11 years. Especially, during COVID with all those changes. And now, it's truly like a health and human services model. And she really pushed through all of it. So she learned a lot. She taught us a lot, and she knew a lot of the community members. And so she made everybody feel welcome. Permits are nobody's favorite thing, but she made it a good process for everybody. A lot of what we do is important, I think, from a policy standpoint. From enforcement, we have to, enforce the rules, but I think customer service is one of the biggest things that is most important part of our job. So I think Cindy embodied that. She did a great job as the face of the department, working with people, and I've only heard glowing things from the community when they've had to work with Cindy. So we'll miss her. I'm sure she's having a great time, enjoying the sun while we spend the days in the cold here. But she moved to Florida. Yeah, so we wish her the best. I'm sure she'll be back to visit at some point, but yeah, just wanted to say thank you to her for all of her years of service. So you'll still see right here, our name tag's not quite accurate. This is not Cindy.
Cindy.
Yes, big shoes to fill. Yeah. But I'm sure you all know, but Jonathan, have you met Dan before?
I don't think I have. No.
So,
Nice to meet you. You too.
Dan's been nice enough to fill in to do minutes for us for the interim until we have a new administrative assistant. Dan's actually our health inspector here in Wakefield. Yeah, so thank you for doing this.
Of course.
Yeah, so the health director's report, we'll kind of keep it short. We don't have a whole lot going on. Melissa's here. We're going to talk a little bit about open meeting law training. I think we had sent that out a little bit earlier before the new year. But I just wanted to start off by saying we had a bit of a run towards the end of the last calendar year doing inspections. We wanted to make sure that all the work that we had done with the restaurants didn't go to waste over the course of the year. So we had about 2 weeks where we really worked with the restaurants that struggled somewhat during the year. And we're pleased to say that the vast majority of them really performed well. I think that's a testament to Aaron and Dan as well, our inspectors, taking the education first approach. I know we had some bumps in the road last year, a couple of closures here and there, but really the main point of it was to educate and to bring these restaurants to compliance. And I think it really showed during the last couple of weeks of the year. During one of their busy seasons, we went there and we were able to see that these restaurants have made strong improvements in a lot of areas. So I think it's a good thing that the town of Wakefield can feel safe eating out in its restaurants. I think these restaurants have shown a dedication to food safety, which is great. It's an ongoing process. I believe this year, we'll probably have a couple bumps here and there, but we want to make sure that we maintain our inspections. So kudos to the restaurants as well to maintain this level.
What do you think was the most common violation that the restaurants have had in the past year or so?
That would be inaccessibility to hand washing things.
Oh, wow. Oh,
Yeah.
okay. Was there a reason why? Because that's usually in the site plan, am I not correct?
No, it's just kind of the nature of how restaurants when it's a smaller or mid-sized restaurant, a lot of the times you see like a barrel that's placed in front of the hand washing sink, or it could be they're putting dishes in the hand washing sink that prevents people from, it discourages them from washing their hands to do so. And it's just very common, happens all the time. And there's all sorts of things you find in hand washing sinks. So,
Be used for what they should be.
yeah.
Yeah, I think another thing that, I think Aaron and Dan were in the restaurants more than I was, but one of the things that we did see pretty commonly was a lack of person in charge.
Yeah.
And I think that can actually have a trickle effect on other issues in the restaurant, right? So you want somebody who's confident, who the person in charge needs to identify themselves in the beginning as like, they may not be the manager at the time, but they are the person who's going to be in charge of the inspection. They are the ones, everyone follows their lead, right? So in the restaurant, that they're making sure that the workflow is great, that people are following food safety standards, that they're, following cleanliness protocols. So I think that's an important thing, is that we establish with these restaurants, even though staffing is a big challenge, turnover is a big challenge, but you need that consistency, whether that's the owner that's going to step up, whether there's a manager that's consistent. We need somebody who's going to be a consistent person in charge, or at least somebody that's always there. You can't have someone, the person in charge going to shop, pick up ingredients while there's no one at the restaurant who is willing to take charge and make sure that the standards are being followed. So that's one of the big things I think this year that we want to make sure that they keep on top of, is having a person in charge that is both competent in that role, but also willing to be a leader in that. So.
Anybody else have any questions?
And then I guess we'll follow up with the open meeting law. So we sent out, or Melissa sent out, did some research and sent out some materials before the end of the calendar year, just to kind of go over open meeting law trainings, not just this board, but other boards as well. We've seen some new members come on. So it's always a good thing to just, to do some kind of training across the board. So we're all sort of standardized and understanding, the rules around open meeting law, making sure that we stay in compliance with that as well. So Cheryl Zabara, who is an attorney that works for many places, she's at the Massachusetts Health Boards Association. So she actually is one of the kind of big trainers in this area. So she has spent a career, creating trainings for open meeting law and other things as well. But I think she would be a great resource to us. She's also fighting a million court cases, for the state at all times. So she's, but she's always made time for us. So what I'm doing is I'm actually in the process, I've reached out to her, see if we can schedule either an in-person or even a virtual kind of meeting at one of our Board of Health meetings, so that she can kind of give like a quick overview of what's going on. I'm sure they have trainings that are already kind of like preset. So it'd just be a good idea for all of us, all of our boards of health, to kind of be up to speed on that. So.
Would you also at that time, I know I did send an email to her, but I know how bad she is through public health, is the training that was for public health boards that we used to have in person. So from what I understand, it now turned to online.
When I heard it, I think it's online.
Yeah, it's online now, so maybe we could look into that. I felt that was a really good training for me, and I worked for health department when I went to do it, and I actually taught at one of the last in-person ones, taught a class there. But I just found that it was very down to earth for people to know what you can do and what you can't do. And as I always say, we're policy and procedure. I always kind of put that little zing in, and people don't understand that. And I had suggested, I know a long time ago, that once we got all three communities up, that if we could have something like that, maybe with her in person or one of her people. But at that time, I also would like to invite the whole health departments and the administrations in each community, town councils, your town administrator and your mayor, because I think that they don't understand. The average one does not understand what we do at all. And you probably have been questioned many times. Oh, can you do that?
Yeah.
Is that your job? They've done that. So I think something like that may also help. And it's kind of a nice review too, to remember
Of course.
what your job is, what your duties are.
Yeah, and I think it's important as well, like, for staff, our staff role versus the board's role versus, so, and then also how they may interface with other town entities as well. So just understanding those rules is a big thing for us. So if we can, the best case scenario is we could schedule maybe like a tri-board, like all three of because we've done this before, our health boards in all three towns have come together for like a meeting. Sometimes we'll do it like every twice a year or quarterly. Just so it's also a good opportunity to share ideas, obviously in an open meeting, but share ideas, talk about the challenges facing each community, and then, see where there might be some overlap where we can work together on things. So maybe we can find that opportunity as well to kind of like do it all at once so that all the boards get to see it.
Yeah, do we have anything have you thought of anything, or has anything been brought up of having a tri-board meeting? I think the last one we had was with you, right?
Yes.
When you first came,
We had one
before Stoneham came.
before Stoneham came. No, actually, no, we've had.
Yes, they were there that night with Laurel. Yep.
Yeah. So I think that was,
We were in Stoneham, maybe?
We were in Melrose. We met at Melrose.
I think we had it in the second floor conference room. So it must have been like last year.
Yeah, over a year, I think.
Yeah, so we can try and schedule one. I mean, it could just be during like a regular Wakefield Board of Health time slot. So it could be like a Wednesday night at 6:30. We can even host it here. So we have plenty of space here. Yeah, we'll host it here, and then we'll invite the other boards to come, and we'll just have like a standard meeting, but all the boards will be here. So we likely won't have like individual community business that day. Like we'll do minutes that day, but we'll probably just take that opportunity to do training and then do that.
Did I understand correctly? You said emails have gone out about the open meeting law? Is that what you mentioned?
I think Melissa had sent out like some handouts.
Material to all three of the boards.
Did you not get that?
That was on December 30th.
Yeah,
No,
December.
but through our.
Maybe I don't have your correct email. You want to give it to
I
Dana?
see it was sent to marciamacaulay@hotmail.com,
Ooh.
all one word.
I get I've had that email address for 20 years. I get so much email in that. So I would have thought it would come through the town email address.
Yeah, so we should
I didn't have that one, so I'm sorry.
okay.
Oh, okay.
I can go ahead and forward it.
Actually, it was sent the 16th, excuse me. You sent it the 16th and then Elaine responded.
I responded.
Yeah.
Okay. And to my Hotmail. but-
That's correct.
Okay, because I literally get 100 emails and I can't keep up with deleting them fast enough.
I bet you could find that though.
I'll go back and look at for it if it was on the 16th.
Marcy, if you can't find it, just let me know and I'll
Okay.
send it to your Wakefield.
Okay. I really should open a new one because I get so much spam in there that I
Actually,
miss.
Marcy, I'll
things.
send it to you right now.
Perfect.
Where would you prefer? I
Well,
send
if
it?
you can send it back, then I can flag it, like, because I'll be looking for it.
And again, you mean,
rather than In
So
the,
not your Wakefield address?
or maybe send it to
Town
both.
address?
Yeah.
well, if you want to do the town, that'd be perfect.
Let's do it.
Perfect. Thank you.
You bet.
So yeah, it's some introductory material. We'll have, I mean, the training will be more in depth, but this is kind of like a nice kind of introductory to open meeting law, making sure that we're all.
There was about a roughly 20-minute presentation by Shannon Phillips, who is the solicitor in Melrose, and then a couple of handouts.
Okay.
So that's what you'll see as attachments.
Great, thank you.
I will
Appreciate
also
it.
go back to, remember we did the training for the, how to have a hearing, a public hearing?
Mhm.
I think I still have all the slides on my phone. That was really, really good. We did that with Ruth. That was online, but that was a good one.
Yes, I
was
remember that
Very
one. It
good.
was good.
I think that would be a good idea, because we may or may not have a couple of hearings a year. I mean, we don't have a lot, so it's a good reminder, like before we have one, we don't kind of run up against it when we have to, so. Any questions about kind of like the ideas for trainings and stuff? And then, other than open meeting law, like, I realize that, you guys are volunteers. So at the end of the day, like if there's any professional trainings that you guys would like other than open meeting law, like we're happy to kind of get those on the books too, whether you do it on your own time or it's a big enough thing that we do it like during one of our meetings. I think it's always a good idea to have kind of professional development in that sense for our boards as well. So. Tattoo.
Tattoo license?
Yeah, we'll get our tattoo license.
We'll get our tattoo license.
Oh, okay.
Yeah. I think we can do it after permitting 5 of them at once all the time. Actually, we just, yeah.
Oh, yes, that's great idea.
Do that.
We'll make a night of it.
Practice.
I can color in between the lines.
Right, okay, great, okay. I just also want to see this opportunity, and also with more questions about trainings or anything. Want to get this out. Do you want to have a chance, kind of talk about, because I know you're our liaison to town council. Are there any kind of things you wanted to mention, like priorities that you're looking for this year?
I mean, I would just mention, first of all, I'm glad that you're looking at kind of the open meeting law piece. Obviously, we have some resources at the town level, and certainly if there are questions on specific things, Tom Mullen is the resource to use, as all of us do. But I think, it's complicated. There's a lot there. And so I'm glad that's something you guys are looking at. From a town council standpoint, where we are in the calendar, we're in budget season right now as we're preparing for the town meeting in May. And so that's really kind of our focus. And obviously, as kind of the liaison to Health and Human Services Department, Anthony, I'll set up some time with you to kind of go through what you guys are thinking of from a budget standpoint. But that really is our big area of focus now for the next couple of months as we're planning through that. So certainly if there's anything from a health perspective that's important, please let me know, and we're happy to kind of put it in the hopper for consideration.
Good. Just so the board knows, it's a bit of a tradition, but we will go through the budget with the board once it's established. So Kevin Gill is working on our budget. We're actually towards I think our budget's towards the later end. So we haven't received it yet, but once we do, we'll have a Board of Health meeting before we have to present to town council. So we'll have a chance to discuss the budget and everything. So once that comes out, I'll send it out to you guys. You can take a look in advance, and then we'll have a meeting. Well, our meeting will discuss later date. So February or March.
I have a question for you. I was questioned today about the ARPA funds by an organization. Are they all now completed?
I believe they're either spent or allocated. Yeah.
Under the law, all of the ARPA funds had to be either obligated or spent by December 31st, 2024. So not everything has been spent. We do have a little more time for kind of the tail spending for those, but everything has been either spent or allocated under, a documented agreement that satisfies the requirements for ARPA. So for example, we had allocated a certain sum of money to the Affordable Housing Trust. They haven't spent all of that yet. Part of it's used for their rental assistance program that they've run, but we have basically a memorandum of understanding governing how those funds will be used so that, they count as being allocated.
It was another organization from another community, and when they mentioned it, I go, those are gone. And then looking at me like I was nuts.
Had them for a good few years now, but and then we were able to use it for, and the town was able to use it for a lot of great things. So
I think a lot of towns did good work with it too. Cities and towns spent it wisely.
well, actually, as a nice segue to the last thing on my report was the social services coordinator. So again, thank you to the council for investing in the Health and Human Services Department. The position started with ARPA funding, actually, and we wanted to see, that this would grow into helping residents connect with resources. Jason Stone was a great resource when he was here. We're happy for him in his new role. But this position, we've actually made an offer to a candidate. So we are awaiting, like the standard HR protocols. But once that clears, we should have somebody coming in, hopefully within the month. So we're very excited to have someone come and fill that spot. It's been sorely missed.
Yeah.
The Council on Aging has been wonderful filling in. Karen Burke and Beth Greenberg and their team just has stepped in to help residents with kind of the interim needs, that's heating assistance, other stuff. But yes, with the new person coming in, they will reestablish our connection with the food pantry. They'll be very present. So yeah, we're looking forward to that person joining us. So.
Their role will be basically just a carbon copy of what Jason's was. They'll be doing.
Yeah, I think Jason, while during his time here, really helped us expand kind of the scope of that role. So every person's going to bring kind of like their own strengths, and so we'll lean into this person's strengths and what they bring to the role. But we do, like, the job duties will be very similar to what Jason was doing before.
Now, is the senior center doing the fuel assistance for everyone, or?
They've been helping with that. We are coming to, it's very cold right now. But we haven't seen as many requests recently, but because a lot of them were front loaded, there was a bit of a cold spell early. Now we're kind of in that role again. The town side heating assistance has ended, but Leo, the state side assistance, is still ongoing. So people can still apply for it, and then the application is a little bit complicated. So helping them navigate that piece is really important. So that's the request that's been pretty prevalent. Yeah, that's really it. Otherwise, things are going well. And then maybe if we want, we can talk about, after this part, we can talk about next meeting, and we can also decide if there's a time that you guys would prefer for like a tri-board meeting. I can float it to the other boards, and we can kind of figure that out, so.
What's the plan for replacing Cindy?
So we're working with HR right now to try to get that position posted. I mean, as you guys know, it's a really important role. It's basically all the stuff that keeps us running. So yeah, we're in the process of getting that role posted as soon as possible.
What about her other like tasks right now? Who's kind of
It is a bit of a piecemeal.
guessing we're not doing permits tonight?
Luckily, we passed through permit season and Cindy wrapped those up before she left.
Okay, so that stuff is,
I will say Dan has been extremely helpful in covering a lot of those kind of day-to-day tasks for now.
thank you, Dan.
Yes. Well, we do need to find someone soon because Dan needs to get back to inspections, but we've been trying to kind of cover that. She's out, but.
Are there any new grants or anything out there that you've seen that you thinking of going for, or?
So we've looked at some grants. I know the 84 is active again, so that's the kind of youth arm of tobacco prevention and control. So they've just recently opened up a grant. I don't know if the youth are going to go for it. It just depends on kind of like what the interests of the youth are this year. I will say Wakefield's got one of the best tobacco prevention and policy arms already here. So they've done a lot of great work. So we'll see what kind of like the youth are interested in. We are in year 3 of the third, we're in the third year of a 3-year grant for the Stop School Violence Grant. So that was the 3-town Melrose, Wakefield, Stoneham grant that focuses on preventing youth violence and bullying, especially from an electronic medium. That's one of the focuses. So we are looking to potentially renew that grant. It was $1 million over 3 years. That actually funded an adjustment counselor position at each of the school districts. So we had a full-time adjustment counselor at each school district for the 3 years. A lot of our school districts are experiencing kind of a financial crunch during this time, but that doesn't mean that their needs have decreased. So this position really helped kind of like take some of that burden off our existing counselors and kind of have a focus on kind of behaviors. So that grant we're hoping to renew potentially with the organization. I think we'll have a more complete report of all the activities from that grant over the last 3 years. But it's provided a lot of great work. It's established kind of like a culture of restorative practices in the schools as well. So we're hoping to continue that work, and we'll reapply. And because of the positive experiences we've had from this grant, I think they'll still look favorably upon our next application. So yeah, so that's one of the grants. And then we're always on the lookout for other things. I know Mass Call 3 is actually a 6-town grant. It's held in the fiscal agent is actually in Medford. They focus a lot on like substance use prevention, behavioral health. They've reached they might be in just fiscal year 4 maybe of their grant, but they've actually during COVID had received double funding during this time because of the extra need from a youth behavioral health standpoint. But next year they're going to be going back to their single funding source. So some of that funding will decrease in the grant, but they're still providing us services in the region. So we're going to try and support them in the work that they do. So we'll have more updates from that, but at the moment, this is kind of what we're looking at. So.
And are you going to reapply for the public health internship grant?
The Department of Public Health. Yes. So every year since I've been here, we have applied for 3 one Stoneham joined us, 3 interns a year. They're through the Department of Public Health. They are generally Masters of Public Health students in our region. We've had 3 successful years of interns come and go and work with all of our branches of our department. They've each kind of shown different interests in different public health areas, but all of them have just done a great job during their time here. So we are going to apply. I think the deadline's February 8th, but we will reapply for 3 interns. And depending on the year, like the first year we got 2, second year we got 1, the third year we got all 3. But just depending on who's available, we would welcome anybody to come and join us. So yeah, so we'll apply for that as well.
It's like I get the notice every day from them.
Yeah.
Applying, are you applying?
Oh, yeah, absolutely. They, the interns give us great ideas. I mean, sometimes they have interests of their own, and what we can do to support them is really important, so.
Sounds good. I'm into grants today because I sat in a meeting with grants, so.
That's good.
I have a question regarding tobacco policies. You mentioned. Did we send out an official notification to the stores now about the new tobacco policy and,
Nicotine-free generation.
yeah,
Yeah, so we sent out a notice to them, all stores, and Maureen actually made, we sent out notice and Maureen made individual visits to each of the stores. So she handed out, the information, and then she also handed out like these, kind of like cheat sheets almost, like basically, so it's making it easier for the clerk to like know, because the policies, it's only a paragraph long, but if you're a clerk, it's more practical to kind of have this that says, explain to the customer, if you're born on or before January 1st, 2004, then we can sell here. And if you're born after, we can't. So we have like a simplified language version of it so that, the clerk can kind of point to this and say, it's more so for the store so that, the customers don't take it out in the store, right? It was a policy that was passed by the town. So the store can more easily explain what the policy is. So we've made a visit to every single tobacco holder, permit holder here in Wakefield. So.
They did do a they did a segment on the new tobacco-free generation last night on one of the news stations.
Oh, okay.
And because Needham is the newest community, so they
Needham is the-
did a big spiel about it, like they had, invented it. But then when they went to mention, there were like 13 other communities and they mentioned Stoneham and not Melrose or Wakefield. I was very heartbroken. And Winchester. I was
They skipped over us.
No, we should have been up at the top of the list, so I just wanted to let you know that at least one of your communities, Stoneham, was mentioned.
One of them were on there.
I think they were like technically the first of three of us, right?
They were actually technically the first Board of Health, but
It's okay. It's all right.
All right.
Same,
all right.
same team.
Okay.
Same team.
no prize for second, no. No. But yeah, so we plan to continue doing education. We've talked about, whenever there's a major policy put in place, our thing is, it's enforcement, but also education. So we will work with the stores, I'd say, for at least the first couple of months, like even if there is a violation, because we do keep up with like checks and everything, but if there's a violation, like we're going to work with them. We may not enforce the full fine, or we may not enforce the full suspension, just because this is a new policy. So we're interested in working with them rather than being penalizing.
you have newly 21-year-olds going in to try to buy cigarettes? Is that, how would you know?
So essentially, anybody born, so now we're past the January 1st, 2025 effective date. So from a technical standpoint, you could have somebody born like just after January 1st, 2004, that's also now turned 21, that now falls in that group that is not able to purchase, right? So we would have to have somebody go in there and purchase, and it would not follow that rule. So then at that point, that would be a violation of the new policy. But like I said, because
What we actively do, like it.
yeah, so Maureen Busby comes to some of our meetings. She's actually our regional tobacco control, and she covers probably 17 communities now, but 7 communities. So what she does is there's a youth buyer program. So what happens is a youth that's either underage, or in this case now 21, but born after January 1st, 2004. What she'll do is she'll have them go into the store and attempt to purchase a product. And they will ask for a standard product that could be like Zyn, like those nicotine pouches. They could ask for like a pack of Marlboros. They'll go in, they'll ask for the product, and if the clerk is doing what they're supposed to, they will ask for ID. This person will then, if they ask for an ID, the person will say, "I don't have one," and they will leave. And then that will count as compliance. So that means they have met the compliance, they've asked for the age, they followed the rules in the posters that they have. If they decide to sell a product to the person. So we've had this happen actually this past year. Wakefield Convenience by the tracks over there actually sold a flavored product to one of our buyers. And flavored product has been banned in Massachusetts for over 5 years now. But so that in that case, that would be a violation, and outlined in our regulations locally here. It's a $1,000, $2,000, $5,000 fine for a first, second, and third offense. It's steep, and then it's a 3-day, 7-day, and 30-day suspension that goes along with it. So And this has been, years of education and, the policies haven't changed except this year, right? So with nicotine-free generation, which is why in the beginning, when I said, we're interested in working with the stores, we're not looking to, in the beginning penalize. We want to make sure that they're used to this new rule. But, in the past, we've had the same rules for a long time. And so the penalties were pretty steep, but, Wakefield's actually been pretty good for the most part in terms of stores being in compliance. We've had other communities, not R3, but we've had other communities where there's been like 7 sales to a minor in one day. So that means there remains work to be done, I think. So I think this policy just represents kind of a slow rollout for, rollback of tobacco. But again, we're working with our retailers here to make sure that they're up to speed on it. So we're not looking to penalize right away.
I think a lot of it, credit, I hate to say, I give credit where credit is due, and what I've seen is to Maureen Busby, because I've worked with her for the past like 14 years in this community and elsewhere. She does really and truly make sure that the store owners reminds them of training their people and what to look for the IDs and things like that. And I think because we have she's so on board with everything, and she really and truly makes sure that they understand it. And if there is a violation, she will go in and she explains everything all over again, and to make sure they do all the training again, because that is the responsibility of the owner of the store, to make sure that his people in that store, when they're working, do know and have been trained on those regulations. And I think that's why we don't have as many. That's my personal, it's my personal and professional opinion.
I think, Maureen's done a lot of education in person with the retailers. And so there's 2 parts. So there's the youth buyer program, and then there's also just the inspection process. So she'll go in, she'll make sure that the products being sold meet the requirements. So less than 3 milligrams of nicotine per product, or it doesn't exceed 3 milligrams. Things like flavored products aren't present. Make sure that they have the appropriate signage. Make sure that all the tobacco products are out of reach for, if it's a convenience store, out of reach of the public, because it's an age restricted product. So you don't want kids being able to reach it. So it has to be behind the counter or locked behind a humidor. So there's a lot of things that she goes and checks for, but she takes those opportunities when she's doing the inspections, not just to check if they're doing things correctly, but also to educate at that time. So,
Do you think it's time to have her come to a meeting again and do a little thing while our meetings are on Zoom, so that the public could tune in?
yeah, absolutely. I think it'd be a great idea for her to come and talk about the new policy. We can also talk about how the rollout's going. I mean, in like the first couple months policy. So I think that'd be a great idea.
Maybe like in March or something.
And March or April,
Give her-
April would be real
Yeah.
good
Just give it some time
Yeah.
to.
to roll. Yeah, that'll give it 90 days, right?
Yep.
90 days, yeah, we'll give them 90 days. And I know that I mentioned in the past, and I hate to be a reminder, but I have asked that if there's something that our food inspectors could do for the public, because I, coming from the background in doing inspections myself, realize that people have no clue what these people have to go in and inspect and what they're looking for. And I think now the general public wants to know more, and we've been, very transparent on everything. And I think in reading sometimes the report, on knowing what we're writing, and them just to explain it. And I think that, both our inspectors are great in all 3 communities. I've been with all three communities, but I think that Erin and Dan do very well here. We have a lot to cover, and maybe something like that would help, because I've had people say to me, I don't understand.
Yeah.
And you tell them, and then they go, oh. Yeah, I don't know if you saw last night them pulling the coyote out of the dairy. Did you see that?
Oh, no, I
Coyote
didn't.
got into a store, and somebody saw the tail, and they thought it was like a little cat or a dog, and poor animal control officer was out in one of mid-states, and he goes and he pulls it out, and it's this huge coyote. And he starts to run around, and the thing goes further on down through the aisle and went right into the cheese section again in the back. So, I don't think people realize that it's a little bit of a danger too, if you were that food inspector going, oh, I wonder what this is. When you hand it.
I'm glad to say we haven't had any wild animal encounters yet.
No,
No, not yet.
No, we haven't yet. No.
Nothing larger than a rat yet.
Yeah.
And that's large enough.
Yeah, that's big.
No, that's a good idea. So we'll put it, we'll put it on the books as well, because I think Maureen would be great for Maureen to present, and then we can also schedule inspectors to do kind of like a brief on, how it works, how inspections works, how to read a report,
I
that's.
wish we really could. We talked about maybe partnering with WCAT, which would be very, very good, and have them, if we could get somebody to volunteer, one of our good places, they're all good anyways, and have them actually go in and let, film a quick thing of, and I think 'cause sometimes seeing and watching, the visual sometimes gets to click and realizes what they have to do. It'd be nice to see, with like a white coat and a little temperature.
Don't get Dan started on this.
That's
We
right.
could be here all night.
Yeah.
No, but that's a good idea. I think it'd be good for the public to kind of understand, like, behind the scenes, what it is that we do.
Especially a supermarket, because that always got to me, because the inspector's going into a supermarket. Takes a long time to do that inspection, and people will be calling for something and say, you can't rush through that. There's a lot of things to do, produce and meat and, milk products and all that. And it's a lot to do. And I think something even like that. We only really have, we have big shores. I think they,
Farmland.
farmland.
Farmland, Shaw.
Yeah, something, yeah, that would have all the different varieties, so people would see how you have to really be on, you have to know what you're doing too, in order to go in and do that inspection.
Of course.
And I'd like people to know that you do know that.
I think that's.
That's my director hat going. I'm sorry.
Was there anything else?
Oh, what else can I ask for? Anything else you want me to ask for?
You can ask anytime.
I still wanted a community CPR class. I'm still
Yes.
pushing for that,
Oh,
for
I just
choke.
finalized mine.
Yeah, for CPR and choke saver probably.
Okay.
And I have had the suggestion from a lot of I'm an instructor myself, and the people that belong to our little group, that when we do go in, we do the choke saver, that they should do a basic CPR class at the same time.
Mhm.
And just do them, what do you get? You're not getting anything anyways, but at the same time, you look teaching them that, then teach them how to do the CPR at the same
Yeah,
time.
probably like 1 out of every 10 inspections I go on, one of the operators will say like, hey, is there gonna be a CPR choke saver course? I remember, Ruth used to do this, and I was like,
Yeah, we did.
yeah.
We used to do it once a year.
Yeah.
Yeah, once a year here. Mhm.
We have a lot of good restaurants here that would probably partner with us to, we could work with them in their space and, make it a more comfortable space for people to come and see.
And I think CPR is getting more commonly known by everybody in the communities.
Mhm.
I would love to see insurance companies approve to purchase AEDs for homes. At least give people some that need them. There are some people that I wish that they had had that AED in their home. They had known histories, and if they had had it, the outcomes may have been a lot different. I'm just speaking about that, but I don't know if that'll ever go anywhere. I'll have to get something in the Senate or something for that.
I'll just make a suggestion on the CPR and choke safety classes. That might be a good thing to partner with, like the rec department or the senior center. I think there's a lot of interest in the community in that. And, we're always looking for more programming in those areas. And so
Food pantry, they're a great group.
Yep.
to work with.
Yep.
Great group.
we will have soon extra space at the senior center to do
Yeah.
classes like this. So I think it's something that would, if we were able to offer it, and even if it's something we were able to offer regularly, I bet there would be some good take up for that.
I'm excited to see the new space. Senior center, it's gonna be great. But yeah, no, definitely. I think we're looking into offering that kind of community wide. There definitely seems to be more interest now. So it's gonna be great. So we'll do that.
Anybody else got anything? Nobody else?
I got
Am
nothing.
I the only one
Just
that's asking for?
always monopolizes.
Yeah.
Huh?
I didn't say anything.
What did you say? Did he say something?
I don't say you monopolize the meetings.
When he calls me for something, okay, and yeah. But what about this? Can we get this too? Okay. I
I
think
had an interesting experience over the holiday. I bought raw milk for the first time. And I love raw- It was fabulous. I hate
Yeah.
raw. I've not had milk since first grade because makes me sick. And so I've been reading a lot about raw milk. So I went to a local farm and bought it and drank a glass. I'm just gonna drink a glass. Absolutely delicious.
What's it?
The reason I bring it up as interesting is I didn't realize you have to give your contact information to buy raw milk. So that falls under the Board of Health, I would imagine.
If we had farmers.
I mean, if we
Right,
had, but
Right, yeah.
did not,
Correct, yes.
was
Yeah.
like,
I have.
wow moment
Yeah.
for me.
Wow.
Yeah, I mean, it's more of a safety precaution in case something happens, they know how to reach you, like, contact
Yeah.
tracing, so. Yeah.
Yeah, but I was surprised by that, like.
Was it, how was it price wise?
You know, I don't even remember because it was such a little, like, a big farm,
Yeah.
little building for what they sold, which was basically pasture raised meat and raw milk and eggs.
Oh, wow.
And so they didn't even give us a receipt. They wrote down what we bought.
Oh,
And then they had us give I think they would have, we asked, but we didn't, because we paid with a credit
yeah,
card.
right.
But then they had us fill out the thing about the milk. So that was when I learned about that. But yeah, it was my first experience with
They
that.
tasted really good. huh?
That was so good. I think that, you know, sometimes in the pasteurization that people can't drink it when it's been modified. So I never have been able to drink it, and it would make me sick to my stomach. So since first grade, I haven't drank it. And I bought it to try it because I've been reading a lot about it. I was like, wow, this is really, I enjoyed it. I thought it was delicious.
What about the concern with H5N1,
One.
the avian flu, the transmission through?
The cows, it
Yeah.
goes through the cows' nostrils. Am correct?
I was
Cows'
raised on a
nostrils.
farm.
Yeah, see, she has that back.
We, you know, we walk through a lot of animal stuff and,
Yeah.
you know, so I don't tend to be really an alarmist about those
Yeah.
things. In fact, I think that being raised on a farm made me and my siblings very healthy and strong. Like we were never sick, which is good because we were self-insured, which used to be a
Yeah.
thing back then too. Your family had
Right.
self-insured by insurance. So that would have been on my parents if we were sick, but we were
It's-
never
It
sick.
is true. We're looking at it from the public health sense because of the bird flu, as we say,
Yes.
going in and the data that is now out with on cows and in dairy. And it was always in public health. You never drank raw milk. It wasn't pasteurized. Go to the Public Health Museum and take your tour. And that's the biggest thing about the pasteurizing. And milk was the very first one. But there had been a trend in the last like 5 to 6 years to go back to that. And I think now that the bird flu and this is coming out, where it was coming from a couple of dairy places that a lot of people are getting away. And somebody told me that it was very expensive, but I
I
couldn't.
feel like we
I don't-
bought some grass-fed steaks and I feel like overall we spent $45 and we came out with a decent amount of stuff.
Interesting.
Yeah.
There's for our food inspectors, there's a new one for you, for raw milk to,
It was just so interesting to me. I'm like,
We don't
really?
grant their permits anymore.
I know, yeah.
Dairy permits are a bit of
I haven't, the last person I know, that she drank it for a while, she was telling me, but then she stopped specifically because she was a little concerned about, I think the place she was buying it from, and she said it got expensive. And she was just saying she doesn't want to go back to it. And, you know, you're saying good, I wouldn't know the difference, but you say there was a difference, so.
It was a pretty
Yeah.
noticeable difference to me. But and then again, I don't drink milk and, you know, I haven't drank it so long. I got sick in the first grade from drinking it and I haven't drank it since. But the little farm was so interesting. They had dairy cows, beef cattle and chickens. And they had this whole little thing, shop where they sell all these farm raised.
Chickens, we have to have a clerk for the chicken permits come up.
it's our number one permit in Wakefield is chickens.
Mhm.
Sounds
A
good.
lot of people will be getting them now with the price of eggs.
Mhm.
I think we're gonna see
Oh,
a
yeah,
big
a
surge.
huge shortage now.
We get a big surge. Guarantee you. There's nothing wrong with them as long as they don't get bird flu, because they get bird flu, they go out, but it's not out of our hands. That's the
Mhm.
agricultural, they come in for that stuff. That's one good thing. I don't know if you're aware of that, Mr. Chines. You know, they come in and I went to the very first thing that they told us, how they euthanize the whole flock, and I'm going, oh, mamma mia.
You've got to be glad that's not part of our local board. of
Yeah,
health
I'm just
responsibility.
glad that we don't have the chickens that, you know, would have a chance to get it, so. Does anybody else got anything else? Anybody else got any suggestions that we would love this lovely health department to do and bring forward to our community?
Yeah, nothing today.
If you think of anything, we'll be here.
Yeah, we gave you a list. You got a list to work on.
Get somewhere to
Yeah,
start,
yeah,
yeah.
we got some stuff for the next few months at least.
Should we talk next meeting?
Plenty of work.
Yeah, in the next meeting?
Maybe the 19th would be the third Wednesday? That's school vacation week. It doesn't matter to me, but I don't know if it matters to anybody else in the room.
I mean, I don't think I'll be home.
That's like 2 days after President's Day. so-
Yeah,
But
The 19th works for me.
that would be fine.
Yeah.
That's okay.
it should be okay with me. All right, so can we have a motion to adjourn?
Make a motion to adjourn?
I would second that
Second
motion.
it. All in favor? Darcy?
Yes.
Aye, Linnea, aye.
Silver eye. Okay, we will close this meeting at 7:18. A little bit longer than my record, but it's okay.